Hello and welcome to the Southern Neurologic and Spinal Institute family. As a patient of SNSI, I'm going to give you a better understanding of the technology that is used within our clinic and how and why it benefits you and your overall health care. Our lives are continuously transformed through technological advancements such as with smartphones, advanced computer systems, and tablets. Healthcare is no different with these ever-growing improvements. The Federal Health Information Technology for Economic and Clinical Health Act, or HITECH Act, was established in 2009 as an effort to promote electronic health records and meaningful use of healthcare technology. Let's get started on what you will experience in and outside of our office. Some of your health information is used for public health research to identify disease trends and help find new treatments and cures. It can also be used as legal documentation, such as with personal injury cases, like workers' compensation, and also with providing appropriate billing documentation and history. Your personal health information comes from many different places, such as other clinics, providers, and most importantly, from you. It is important that your medical information is cohesive so that each provider can deliver and coordinate correct and quality care for you.
Your health information,
I'm sure many
your
of you are
rights.
weary of the information that is transferred
Whether your health
through the
information
internet
is
and
stored on
computer
paper
systems
or
and
electronically,
may be hesitant
you
to
have
be
the right
involved
to
with
keep
the
it
electronic
private.
health record system.
Those rights are protected
However,
under a
rest
law known as
assured
HIPAA,
that
the
your
Health Insurance
information is
Portability and
safely
Accountability
guarded.
Act. HIPAA gives
The Health
you
Insurance
important
Portability
rights.
and Accountability
First off,
Act of
you have the right to
1996,
see
or HIPAA,
or get a
is in
copy
place to
of your
ensure that
medical
your healthcare
records.
information
Sometimes
stays
you
in
might
the
not
right
be able to
hands
see
and with
certain
who you
parts of the
choose to
full
share it
record,
with.
but you always have the
Please
right
watch
to
this
ask.
short video that
If you find a
explains further
mistake
your
in your
rights
record,
with
you
your
have
health
the right to
information.
request to have it corrected. If you disagree with your doctor or health plan about certain information in your record, you have a right to submit a written statement of disagreement that will be kept with your record. You also have the right to know how your health information is used and shared. Now, your provider is allowed to share your information for certain reasons without asking you first, like when your doctors work together to determine how to best treat you when you're sick, or to report the flu when it's in your area. But in general, your providers can't give information to an employer, for example, without your permission. And if you'd like to know who has seen your health information, you have the right to get a report. That's called an accounting of disclosures. HIPAA gives you the right to say how you want to be contacted. For example, you can tell your provider what phone number they should call to contact you and whether they can leave a message. HIPAA also gives you the right to request that your information not be shared with certain people or organizations. All these rights are spelled out in the Notice of Privacy Practices, which is usually given to you or posted at your doctor's office or hospital. Be sure to read this notice carefully. It lets you know exactly how your information will be used and shared, and how your rights are being protected. And lastly, if you think any of these rights have been violated, you have the right to file a complaint. We're serious about working with you to protect your health information. Know your rights. To get started, just visit the U.S. Department of Health and Human Services Office for Civil Rights at hhs.gov/OCR.
I hope that this video shed further light onto what HIPAA is and the importance to be your own patient or family advocate during a situation where you are in the clinic or at the hospital. SNSI currently utilizes an electronic health care system called Greenway, Although many clinicians still use paper charting, systems such as Greenway are the future to accurate and cohesive health information, therefore creating quality healthcare given to you wherever you are. Our computer system Greenway allows us to update your health information and share it with other providers when needed and with your permission. We also work with e-prescriptions, which allows us to send new prescriptions through our computer system to the pharmacy of your choice, where it should be ready for pickup once you leave the clinic. Another great SNSI benefit is our patient portal called HealthKey, where you as a patient can update insurance, demographic, and other information such as email addresses and phone numbers from anywhere using any technological device, such as your cell phone or laptop. This website allows you to access all services that are provided by our physicians and enables you to message the staff directly. It also allows you to view the history of previous visits and billing and payment histories. To create a new account, go to the patient portal on our website, click on Create an Account, and follow the cues on the screen. Now let's imagine being on vacation, disaster strikes, and all of your known health history is lying in a paper chart where physicians and other family members are unable to share and aid in your health. That's pretty scary, right? Now imagine having your health information in a complete system where all of your information is in one file through a computer system that can be easily transmitted from one clinician to another. This increases the efficiency and quality of care that you receive no matter where you're located through any computer or technological device. Healthcare technology is the future to a greater quality of care. SNSI staff are dedicated to ensuring that you receive the best care possible within and outside of our clinic. Thank you for watching, and feel free to email me for more information or any questions that you may have. My email address is csp1422@jagmill.southalabama.edu. My name is Caitlin Powell. I am an RN for SNSI and a student of South Alabama University.